Peter Fodor, board-certified plastic surgeon, backed by popular demand, and the author of the plastic surgery book, Be Your Best, has been generous enough to come back and spend some time with us, giving us a plastic surgery update. Peter, it's always a joy to have you on the show.
Well, thank you for having me back.
I think this is at least the third or fourth time you've been on, and we always learn something when you come on. So it's generous of you to share your time, especially on a beautiful ski day like today. So let's just give our viewers a little bit of your background. Peter, you originally practiced in New York. Tell them a little bit about your background.
Well, I trained in New York, practiced in New York for about 15 years. Then I moved to California, and I'm currently practicing in Los Angeles and here in Aspen.
Okay, and is there a difference? Do you see a difference? Now you have New York, Beverly Hills, and where you practice, and Aspen are three different patient populations, but they're almost the same in a way because there's a crossover. Is there a difference in the expectations of patients between those three venues?
Not a real difference. I think New Yorkers are still a little quieter about telling people they had surgery. In Los Angeles, they're very overt. They come out and have parties because they had a surgery and celebrate their facelifts. And Aspen falls someplace in between. But it's fun to see the different demographics and fun to see how the cosmetic surgery practice is evolving across the country, because there have been a lot of changes since I came into practice first.
Yeah, you hit on a really interesting point. At one time in history, within our careers, and I should say, for the purpose of journalistic disclosure, that Peter and I used to operate 40 years ago at St. Luke's Columbia in New York on trauma cases. But at one point in our career, people wouldn't talk if they had a facelift. It was very hush-hush. They would never want to tell anybody. Of course, you know, they'd walk around looking 30 years younger, but they wouldn't tell anybody. And now it's almost become just sort of par for the course.
Well, it's become much more popular and people are much more open about it. It used to be that only people in the entertainment business and people of some notoriety would have plastic surgery, but you're absolutely right, they kept it very quiet. Now, there are still patients like that do not want to talk to anybody about, and we put them in the hospital and have what we call AKA, also known as